Hello, Dr. Martha Thurl, physical therapist here. I want to talk about modifications that we might need to do when you're experiencing jaw pain. TMJ joint, or your temporomandibular joint, is this joint up here in your jaw. It's what controls the opening and closing of your mouth. If you are having pain here, it can be quite painful every time that you yawn, sing, talk, kiss, chew, live your life. And we want to talk about some things today that can make it a little bit less painful for you. What you want to do is you want to stop chewing gum, number one. Number two, try not to bite your nails. This causes a lot of repetitive movement of your jaw. That's something that we want to avoid, is those two things. So stop chewing gum and stop biting your nails if you can. Number three is we want to cut our food up into small pieces. If you've had jaw pain, then you know that biting into that fresh, crisp apple might sound like a good idea, but in actuality, it causes a lot of pain. So you want to think about cutting your food up into smaller pieces, particularly if it's something chewier, like a piece of steak, for example, or a big sandwich. You might be the person who's cutting up your pizza. Sorry, I'm not sorry. Fourth, you want to use hot and cold. Using a hot pack or a cold pack, if that helps make you feel better and alleviate some of your pain, that's a great idea. You want to make sure that there's a barrier so that you don't burn yourself. Yes, ice can burn too. And you want to make sure that you apply for short increments, up to 20 minutes on, 20 minutes off, to help you feel better. There are some really great heating packs that are sold for this. If you prefer cold, you can just use cold as well. If you want to do some ice massage, we can talk about that at a later date too. Another modification that you're going to want to make is you're going to want to learn resting position of the jaw to make sure that you're not clenching or grinding your teeth during the day when you're awake. Something else that you might need is an oral appliance. That's okay. We can hook you up with a really great dentist that makes them and that they're fit properly for your jaw pain. So, things to look out for when you have some TMJ pain is making sure that you're not chewing gum or biting your nails, cutting your food into smaller pieces, trying to avoid or limit denser foods like steaks or sandwiches, things that are chewier like breads, or cutting them up into very small pieces. And then making sure that you're getting some hot and cold into the area as is tolerated by you. And as always, consult a physical therapist for a consult so that you can really get to the bottom of it and then not have pain during your day from your jaw anymore. Thanks.